Hello, I'm back. Let us talk trigeminal nerve. It is the largest cranial nerve, and it is the largest cranial nerve when talking about in terms of diameter, when talking about in terms of number of fibers. The longest cranial nerve will be the vagus one because it travels a lot of distance. So it is the largest cranial nerve by diameter and number of fibers. Let us discuss its cranial nerve nuclei and different things. It has a widely spread system of nucleus. It has the main motor nucleus, a small one, main sensory nucleus that is present in the pons, lateral to the motor nucleus. Remember the relation between the motor and the sensory we talked about earlier. There will be spinal trigeminal nucleus. It goes from the pons down to the medulla all the way down to C3, C2, and then there is mesencephalic nucleus. It moves up from the pons to the midbrain, and then in the last we are left with the motor nucleus that is present in the pons medial to the main sensory nucleus. The functions. The main sensory nucleus that is present in the pons, it is responsible to receive the touch and pressure sensations, the vibration sensations. The spinal trigeminal nucleus that moves down to the spinal cord, it is responsible for pain and temperature sensations. See, the spinal trigeminal nucleus, it is somewhat like the spinothalamic tract in the spinal cord. Then there is mesencephalic nucleus, the one nucleus that is going up in the midbrain, that is responsible for the perception of proprioception, the position, the muscle locations, the state of contractions. And then there is a main motor nucleus. The main motor nucleus is the one that is responsible for movement of muscles of mastication, and there are other movements. Let us see that in the next slide. The main motor nucleus, it is receiving fibers from multiple sources. It is receiving fibers from the brain, corticobulbar fiber. As we discussed earlier, it is getting that from both cerebral cortexes. And it is having other inputs from the reticular formation, from the red nucleus, from medial longitudinal fasciculus, from mesencephalic nucleus, and these are for the fine tuning for the other reflexes, and mesencephalic nucleus is for the especially for the jaw jerk reflex. And it output, it goes to the muscles of mastication, the four muscles there, temporalis, masseter, lateral, medial, pterygoid, and it supplies the other muscles, the two muscles that in the floor of the mouth, mylohyoid and anterior belly of digastric, and the two muscles with the name tensor in their name, tensor tympani and tensor villi palatini. So this is the summary of the different fibers. So this functions, all of these fibers we talked about, these are general somatic afferent, all of them. General somatic afferent, that general sensation you are consciously perceiving them. And this is special visceral efferent, the muscles of the pharyngeal arches. So that is shown in the here. All of the sensations, the areas of the distribution are shown in this table from the Snell. I will go into the detail a little more. Let us start with the course. This 3D visualization is from the 3D for medical by elsewhere, complete anatomy. So it originates from the anterior surface of the pons in the posterior cranial fossa, moves above the medial, the motor component is medially. It then expands as trigeminal ganglion, gives ophthalmic, maxillary, and mandibular divisions. They are exiting through superior orbital fissure, or foramen rotundum and foramen ovale. And that is it. Let us move to the ophthalmic division. Ophthalmic division is the pure sensory component of the nerve. It runs in the lateral wall of the cavernous sinus. Here you can see it there, and it go and divides into four branches. A point to remember is that it divides into the four branches before entering into the orbit. One nerve that is distributed outside the orbit, that is this, the meningeal branch that supplies the tentorium cerebelli, tentorial branch. It goes back and it supplies the tentorium. The three rest of the branches, the trochlear, the lacrimal, the frontal, they go in the orbit and supply the structures there. They are purely sensory. So let us talk about the lacrimal nerve. Lacrimal nerve is the branch that goes to the lacrimal gland. Okay, let us see here. It moves above and parallel to this muscle. This muscle is called lateral rectus and it goes on to supply the lacrimal gland. It's the sensory one, but it does get parasympathetic fiber from zygomatico-temporal branch of the zygomatic nerve. The frontal nerve is near the roof. It is above both of the muscle, levator, palpebrae and both, and it exits the orbit to give supratrochlear and supraorbital nerves. The one near the midline is the supratrochlear, and the one that is away from the midline, that is the supraorbital. The supraorbital goes further back to the vertex. These are the nerves, frontal nerves. They supply this forehead area, the frontal air sinuses underneath it, and the forehead and scalp all the way back to the vertex area. Then there is nasociliary nerve, the third one, this one. This is the largest one. It crosses the optic nerve as it comes, and this is the optic nerve. It crosses superiorly to it. And then as it goes, it gives different branches. This is the anterior ethmoidal nerves exiting through anterior ethmoidal foramen. It comes to the lateral wall of the nose. After moving from the anterior cranial fossa, it supplies the interior and even the exterior of the nose to external nasal branches. The posterior ethmoidal nerve is also there, not shown here. Then there is infratrochlear nerves getting out of the orbit from this point, and then there is branches to the ciliary ganglion, sensory branches that go to the eye ultimately through short ciliary, and then there are direct branches to the eye that are called long ciliary nerves, that are sensory branches, and these will be the nerves that are responsible for the corneal reflexes. So these are the branches of the nerves. You can see, revise them from the uh, I will show them in the pictures from the netters also. So here the nasociliary nerve is shown entering. It is crossing the optic nerve. In this direction, optic nerve is shown. It is crossing the optic nerve from medial, lateral to medial, and it is giving rise to these branches that are going to the ciliary ganglion, the sensory root, and from there the branches go to the eye. These are known as short ciliary nerves. The direct branches to the eye, long ciliary nerves, posterior ethmoidal, the anterior ethmoidal nerves. The anterior ethmoidal nerve get to the anterior cranial fossa. From there, it dips near the crista galli and goes to the nose. And in the nose, it gives rise to the branches to the anterior aspect of the mucosa of the nose on the lateral and medial aspects. The lateral internal nasal branches and their same continuation goes outside the external nasal branches of the anterior ethmoidal nerves. So these are the branches of the trigeminal nerves that are responsible for supplying the different areas of the ophthalmic division of the trigeminal nerve. Now let us talk about the maxillary nerve. Maxillary nerve is the second division. It leaves through the foramen rotundum. It crosses pterygopalatine fossa, and let us see it in the video animations. It is moving through the lateral wall of the cavernous sinus. Then it exits through the foramen rotundum. Oh, sorry for that. It exits through the foramen rotundum, moves from the bridges the pterygopalatine fossa, and crossing that it enters the orbit and it goes through this infraorbital tunnel and exits in the front as infraorbital nerve. So that's its basic route. While doing that, it gives rise to a branch that you can see in the orbit. Let us see the branches here. Within the cavity, cranial cavity, it gives rise to meningeal branch that supplies the middle cranial fossa, and then it gives rise to this branch, zygomatic branch, that is further divided into zygomatico-temporal and zygomatical-facial branches that exits the canals of the same name. And zygomatico-temporal one is the one that gives rise to connecting fibers to the lacrimal nerve. Then there are branches to the pterygopalatine ganglion. So there are ganglion branches, and then there are branches to the upper teeth, superior alveolar branches. There will be anterior superior alveolar branches, there will be middle superior alveolar branches, there will be posterior superior alveolar branches that are coming from the maxillary nerve. All of the area of supply is mentioned right here. Now, the pterygopalatine ganglion, it is suspended in the pterygopalatine fossa by the sensory branches from the maxillary nerve. And from here, the major sensory output of the maxillary nerves is distributed. From here, branches go to the pterygopalatine ganglion. They give it is the root. It gives branches getting from the maxillary nerve, and it is giving branches to the orbital branches. It is giving branches to the palate, greater palatine branches, lesser palatine branches. It is giving branches back to the pharynx. It is giving branches back to the nose. I think it would be more easier to look at them here in this particular picture. This one here, for the different connections from the pterygopalatine ganglions are shown. These are the two inputs. From the maxillary nerve, the sensory fibers are reaching the pterygopalatine ganglion. From this, the nerve of the pterygoid canal, the parasympathetic and sympathetic fibers are reaching that. So after reaching that, they are distributing in different directions. In this particular picture, the most of the nasal cavity innervations are shown: posterior superior nasal, inferior posterior inferior lateral nasal branches, and the one that are going down the greater and lesser palatine nerves. And then there are branches that go towards the back that supply the pharynx and all the other branches. Then there is a mandibular division of the trigeminal nerve. It is the only component of the trigeminal nerve that has a motor part. It exits the cranial cavity through foramen ovale, through the infratemporal fossa, and foramen ovale, it gets into the infratemporal fossa. This is the infratemporal fossa whole. We have a whole other lecture for infratemporal fossa if you are interested. And here it divides into anterior division and posterior division. It gives rise to a few branches before division, and there are the branches of each of the divisions separately. So the branches that are from the main divisions, there are two branches. I like the mnemonic for the mandibular division: main trunk, meningeal branch, and medial pterygoid branch. So these are the mnemonic. So it gives rise to this medial meningeal this medial pterygoid and meningeal branch, and uh, the medial pterygoid branch. Meningeal branch is shown right here, going back and with the middle meningeal artery into the cranial cavity, and then there is the other branch that is medial pterygoid. It is not shown in this picture because I am seeing from the lateral view. It is exiting from the medial aspect of the nerve. Let us see them there. This is the medial pterygoid muscle. So the muscle, the nerve that is supplying it, and the nerve that is supplies the medial pterygoid, the tensor tympani and tensor villi palatini. I will show you the picture from the Netter's atlas also. And then there are branches, other branches, anterior division branches. We have done one of the muscles of mastication, that is medial pterygoid. We are left with the three muscles: lateral pterygoid, masseter, and temporalis muscle. All of these three muscles are supplied by the anterior division of trigeminal nerve. So it is supplies the lateral pterygoid muscle. This is the lateral pterygoid muscle, the two heads, and it supplies the masseter muscle that is outside. It moves above the part of the mandibular arch, mandibular notch, sorry. Supplies the masseter, and the two branches, the deep temporal nerves, the anterior and posterior branches that go and supply the muscle of temporalis. And then there is one sensory nerve. That so anterior division was majorly motor nerve with supplying three muscles, and then there is one sensory nerve that is supplying the muscle of the cheek. And here one mistake is usually made, that buccal nerve has a name very much matching the buccinator muscle. It does not supply the buccinator muscle. It has no motor component. It is supplying the buccal mucosa, the area over the buccinator muscle, sensory supply. And then the posterior division of the trigeminal nerve, it has three branches: auriculotemporal nerve shown exiting right here, going up and supplying the parotid gland. So it can be seen here, going behind the temporomandibular joint, supplying the parotid gland, then going in front of the ear to the temporalis fossa. And then there is lingual nerve going down to the tongue, and not only supplies the anterior two-thirds of the tongue, it supplies the two salivary glands, and it gives the parasympathetic fibers, and it gets the chorda tympani branch from the facial nerve and gets the taste fibers to the anterior two-thirds of the tongue also, and the parasympathetic fibers to these two glands. And then there is a branch to the tongue, and then we are left with inferior alveolar nerve, the nerve that is going to supply the lower teeth, inferior alveolar sockets, the lower teeth. So this is the nerve that goes through the mental foramen, mandibular canal. It gives branches to the different teeth. The branch that exits through the mental foramen supplies the interior of the chin and the middle of the lip, and it has a branch that exits before entering into the mandibular canal, that is the nerve to the mylohyoid muscle, and it supplies the mylohyoid muscle itself and the anterior belly of digastric. So with that, we are done with all of the branches of the trigeminal nerve. Let us go through them again quickly. From the main trunk, we talked about the meningeal branch and the branch to the medial pterygoid. Muscle उन्होंने दिखाया हुआ है. Muscle is shown here. If we have to see that, we will have to go for the medial aspect. For the next, the remaining muscles. The branch to the masseter, the branches to the temporalis, the branch to the lateral pterygoid, and there is a sensory branch that is to the buccal mucosa buccal nerve. And for the posterior division, there is auriculotemporal nerve. Always remember the auriculotemporal nerve has two roots that are enveloping the middle meningeal artery, and it is going outside and hugging around the temporomandibular joint, the neck of the mandible, and moving up in front of the ear and going to the temporal fossa, superficial part. And this is the part, and it is carrying the sensory and the parasympathetic and sympathetic fibers to the parotid gland. And then there is this lingual nerve getting this parasympathetic and taste fibers from chorda tympani, branch of facial, going down, having connection parasympathetic relay center, submandibular ganglion, supplying these two glands, submandibular sublingual gland, and getting to the anterior two-thirds of the tongue, supplying the taste fibers, supplying the general sensation fibers to the lingual component, taste fibers to chorda tympani component, and the some salivary glands that are present on the dorsum of the tongue. And then there is this branch, inferior alveolar nerve. It runs in the mylohyoid, in the mandibular canal, supplies the lower teeth, and goes all the way front, and it exits here the mental nerve that exits and supplies the chin and the lip above the chin. And then there is this branch that does not enter the mandible. It moves below the mylohyoid muscle, supplies that, and it supplies the anterior belly of the digastric muscle also. So that's all about the mandibular division of the trigeminal nerve. With that, we are done with the mandibular nerve, and there are some branches that we can see from the better from the inside, from the medial aspect. This is the right jaw, right aspect of the temporomandibular joint, the muscles of the infratemporal fossa. We are looking from inside out. So here the thing that I wanted to show you, the otic ganglion that is related to the medial aspect of the mandibular division of trigeminal nerve. And here the branches of the or this medial pterygoid nerve is better seen here along with the tensor villi palatini and its nerve. This is medial pterygoid, this is tensor villi palatini and its muscle, and here you can see the facial nerve moving in the back of the middle ear that we will discuss next. From the middle ear, chorda tympani, and it is joining the lingual nerve here in the infratemporal fossa, and the auriculotemporal nerve can be seen exiting right here. So these are all the things about trigeminal nerve, chorda tympani, tensor tympani, and all that. So the clinical component of the testing of the sensory component is done by checking the dermatomes. If you check above the upper eyelid, you are checking basically touch, temperature, anything. You are checking basically the ophthalmic division. Below the lower eyelid, above the upper lip, you are checking the maxillary division. Below the lower lip, chin area, you are checking the to discuss the exact branches, and on the face we have recorded lectures on the sensory display of the face also. We have discussed the corneal reflex in the optic nerve with the oculomotor nerve. Corneal reflex is not strictly related to the optic nerve, but we'll discuss it then also. And then there is trigeminal neuralgia. Trigeminal neuralgia is the disease. Um, it is in that disease where the unknown of origin pain is in the area of distribution of the trigeminal nerve. So the dermatomes, whole of the dermatomes of the big one. That's an important one. Facial nerve. Um, we will have a discussion on this. This is a tricky one, but if you get the idea, you will be able to solve MCQs no matter how difficult.